The famous quote, you know, if you like your health insurance plan, you can keep it. No one will take it away, no matter what, all right? So we've already told you, you know, like many political promises from both sides of the aisle, that's just not true if you work in a business of 50 or less people, or if you have individual insurance. So we're going to tell you why that is instead of this. For now, we've just told you it's not true. We're going to tell you why, okay? So what you're looking at right here is the 3 reasons why. You know, very little publicity in the press and the media, but these are the 3 reasons why, if we like what we have, we can't keep it, okay? The first one is called essential benefits. That's 10 benefits, and we'll look at them on the next slide, 10 benefits that every health plan is required to cover. Actuarial value or metal tiers. Anybody heard of that before Tina mentioned it earlier this morning? Okay, this blows up a lot of existing health plans as well. And then the final caveat that really is the stake in the MDA coffin is this community rating rule. So we're going to get into a little more detail on each one of those and why it means we have to change what we're doing. So the first one is probably the least innocuous of them all. It's the essential benefits. Starting on January 1st of 14 in the insured market. I'm going to start defining between insured and our new concept, which is potentially to go self-insured. I want to start delineating between it. So in the insured market is where all these rules and regs that we're talking about exist. And the MDA is looking at potential, just to give a little foreshadowing here, a potential new idea of going self-insured that we'll talk about a little bit. So January 1st, they're all supposed to have the essential benefits, and here they are. So as you look at that list, you get down through about number 8, and in the MDA, as Tina mentioned, you know, we've always been on the forefront of essential benefits or wellness benefits or high caps or all that. We've always had Cadillac type plans. So we've had most of these essential benefits. We've had, you know, wellness screenings and coverages for women's screenings and stuff. So you get down there low to number 9 and number 10, and those are a couple things that do impact in the insured market what we have to do. So rehabilitative and habilitative services. You know, we've always had coverage if you're hurt, you know, you go to the doctor, we pay your hospital bill, we pay your doctor bill. We haven't always said, okay, gee, now you're not able to do dentistry any longer, you know, what do we need to do to make you a productive member of society again? So that's what a habilitative service is, and that's going to be covered by all health plans now. Again, it sounds good, it feels good, but anytime you have benefits, it costs money. I mean, that's why some plans cover things and some don't. It has an impact on the premium. There's always a give and a take. The more things you cover, the higher the premium. The lower the deductibles and copays, the higher the premium. Higher deductibles and copays, reduce the premium. And then number 10 is kind of a kicker to us because I've been here 19 years. I just had my 19th anniversary this week. And I could count on my hands and my toes how many dentists have been interested in buying dental insurance in those 19 years, okay? Most of you aren't interested in buying dental insurance because A, there's not a catastrophic component to it like there is with health insurance where, geez, if something goes wrong, I'm out $2 million or something. B, you can treat your staff and your children and whatnot, you know, maybe more effectively than trying to run it through a dental plan. Well, if you elect to stay in the insured market post-January 14, everyone in the insured market has to have a pediatric dental benefit, pediatric dental and vision. And so that's what I was talking about earlier. We've got 7 or 8 slides to talk to you about how that impacts you as a dentist, not as a healthcare consumer, but as a dentist at the end. We'd be happy to go through those. But for this purposes, it means that if you have kids under 19, we got to add dental insurance to your policy, and it's going to be to the tune of about $20-25 per kid. You know, that is if you elect to stay in the insured market, and we're going to talk about what's going on in the future a little bit. So that from our purchasing standpoint isn't necessarily great, but from us as dentists, you know, maybe there's going to be more people running around with a pediatric dental benefit that can come to your practice. So the metal tiers, we've been alluding to these and jumping around them a little bit, but This is another very little publicized part of healthcare reform, and it applies again to everyone who works at a business of 50 or less, and it applies to everyone who buys in the individual insurance market. And as Tina mentioned early on, their goal was to kind of standardize the policies so that it would make it easier to compare on, on their Travelocity exchange website. The reality is it's probably not going to simplify that comparison much, but what it did do is it totally, made that idea of keeping your health insurance very hard for insurance companies to do, because they got put in the really tight little buckets of what they can offer for coverages. So the reason they're called metal tiers, it's the old Olympic, medals there. You got your bronze, silver, gold, and then the additional platinum. And just like the Olympics, the gold's better than the bronze, and the silver's better than the bronze, and platinum is better than all the above in terms of just generically looking at plans. So if you go on a website now, it's going to have, every plan will say this one's a platinum, or this one's a gold, or this one's a silver. And so if you're looking at two silvers, in theory, they should be, at least they're actuarially, mathematically, if you will, calculated to have similar benefits. But reality is, you could take 100 different ways to get to these actuarial values. So an actuarial value is essentially a mathematical calculation of the percentage of your claims that the plan is going to pay. So a bronze plan is a 60% plan. That means that on average, the plan's going to pay 60 cents and you're going to pay 40 cents of all claims, or 600 versus 400, however you want to do the math. So that's a bronze plan, which is not a very good plan compared to what all of you are used to. We don't have any plans that we offer to any of you right now where the division is where you got to pay 40% of all your medical expenses out of your own pocket, all right? And that goes on up to the platinum, which is 90-10. So most of what we offer now would be in the gold and the platinum range. The trouble, though, is it's very tight. So if we have a plan that's at 85% right now, we actually got to trim benefits to get it down to the 80% window, or we got to add benefits to get it to the 90% window. It's only plus or minus 2% off of those barometers. So again, that explodes a lot of plans that fall in the, the 85, 84, 87 mark. Things have to change. Again, very little publicized. The idea, like I said, is to, oh, gold, I got two gold plans, they should be pretty similar. But in reality, Company A could take a totally different route to getting an 80% value than Company B. I mean, Company A could have great drug coverage and then everything else at 50%. Company B could, say hospital 90% and drugs, you got to pay $100 for every prescription. So it's still, the idea that this is, by putting it in metal tier, is going to make it, so easy to lay plans next to each other and compare is probably kind of a pipe dream, I'm suspecting. So you're still, again, going to need some expertise to help explain copays, deductibles, what your exposures are. You want to make sure, if you're buying a metal level plan, that you're understanding what you're getting into, which is going to probably be some higher copays and deductibles than you're used to. Now this is the last straw that broke the camel's back, so to speak. Has anyone ever heard of the community rating or risk aggregation at all? It's not on your evening news, is it, or in the Wall Street Journal even. So one of the more or less known rules in the insured market for businesses under 50 and for individuals is we're going to risk aggregation or community rating. So right now, those of you with the pink card, we are rated, our premium every year is determined by the utilization of dentists and staff people of dentists, and that's it. We're in our own risk pool. Some of you who have some of the other colored cards, maybe say our group people who had the orange cards, it might be dentists and physicians and chiropractors and podiatrists are maybe lumped into that risk pool, okay? So we're in smaller risk pools right now, and that has been advantageous to us because, number one, we're healthcare professionals. I'm not, but you all are. So you tend to take better care of yourselves. see the doctor, get your regular checkups, we smoke less. The occupation itself, we see on the other side of the thing, some hard hats. There's nothing wrong with being a construction worker or a tree trimmer, but as you might imagine, those occupations are more high risk. People get injured on those jobs a lot more often. You're not falling out of your dental chair and breaking your elbow too often, right? So more injuries on the job, more claims, higher premiums, okay? We also have in that same pool thrown in the insured market, all the uninsured. So all these 30 million people that we're trying to get insurance for are going to get put into that market, as well as all the burning building people I was talking about earlier. So the people who don't want insurance until they get sick, all right? So we're going from our own friendly little family in the insured market where we have been able to really have a good plan and a good rate for members. In the insured world, we're forced in along with all the other occupations, all the uninsured, all the people in the individual market, and all the people in the groups under 50 are thrown into one. So that's really quite different than our current state. We have our own exclusive MDA plan. That's those of you who are paying quarterly. That's the exclusive MDA plan. The risk pool is just dentists and your staff. We've got 9 plan designs, and it's really allowed us to have insulations from some of the higher market fluctuations. So for instance, last year we had no rate increase, flat, 0. The average increase in the market was 8 to 12% last year. So that's in Michigan Blue Cross, not just around the country or something. So we've going back to that question, where's the premium going to be less in the exchange or the MDA plan? Over the years, it's been less in the MDA plan. 2 weeks ago, I didn't know what we were competing against on the market, so I really couldn't answer that question. But now that we're seeing it, we feel the rates are still going to be substantially better in our plan. And that's why we consider this to be really good news right here. So January 1 is when all these rules take effect. So because the government has been making up the rules as they go along, and it's extremely hard to comply with everything and get all your I's and dotted and T's crossed, the MDA came up with a strategy, and we approached Blue Cross on it, and this is not just the MDA, but going on in a lot of health plans around the country. So our strategy is we're going to, this is for those of you, again, so I want to stop and say, these are, you're paying your bill quarterly, you're in the MDA exclusive plan, and you have the pink card, okay? This is you I'm talking to specifically right now. But in addition to that, you could also be a Medicare person with a green card, okay? So the pink and the green cards, what we did is we're going to renew the current existing MDA plan on December 31st of this year. So normally it would renew on January 1st of 14, and if we did, it would have to be all the things we just talked about. Amongst them would be, it would have to be community rated, and basically the plan wouldn't exist any longer, okay? So in order to keep our existing plan for one more year, we're going to renew it on December 31st. The coverage will extend then all the way through December 31st of 2014, exactly the way it is. No metal tiers, no community rating aggregating, all those things go away for 1 year by renewing December 31st. So we think that's really good news. If you like what you have, you can keep it 1 more year. And that buys all of us some time to take a sigh, see what else is going out on the market, and make informed decisions for what we're going to do come January 1st of 2015. So by the end of 14, though, this is a 1-year delay. So this is why it's important you're here today, and maybe that you come back again next year to our seminars next year. By January 1 of 15, we all got to be somewhere new, okay? We are not going to be able to keep what we have right now. So having said that, someone's got to pay for all this, all right? So they're trying to get 30 million people who don't have insurance and who can't afford to pay for insurance. And they're doing that by, giving them subsidies and free money at these exchanges. So somebody's got to pay for that, right? So I don't know. We threw some of the taxes and fees on the board already that have already come on. The medical device tax, the pharmaceutical tax, tax on high wage earners. Unfortunately, those taxes sounded good. We'll get the big bad pharmaceutical company or those medical device manufacturers, but in reality, there's nothing to prevent those pharmaceutical companies from just raising their prices to pay the tax. They raise the price when we buy the drug to give to you, and then we have to pay more for it. We pay more for it, our premiums go up, okay? So that's kind of the equation for it. But in addition to those taxes that already come online, there's actually 6 new taxes on health insurance itself. 6 new taxes on health insurance itself coming on January 1 of 14. So exactly how we're going to make health insurance more affordable by adding 6 new taxes to it, I haven't quite figured out the logic on that, but we do need to share with you that it's coming because you're going to see it on your bills. And this is regardless of the fact, so even though we were renewing that MDA plan a day early and then we get to keep it for another year, that allows us to keep our coverages, but it did not allow us to avoid these taxes, okay? So the taxes are coming to a theater near you, whether you like it or not. So I'm not going to go down this whole list, but I do want to point out probably the 2 most substantial ones. The second one down is the federal insurance premium tax. So all health insurance is like a sales tax on your health insurance. So you go in Michigan and you buy something and they add 6% on, right? So now if you buy your health insurance, they're going to be adding 2.5% to 3.5% on just for taxes. That's the money they're going to use to give the subsidies to people, So it's somewhat of the old Robin Hood approach here, where we're going to get the people who already have insurance to help pay for the people who don't. And I do want to move down to the 4th one there, so that's the marketplace fee. So these are the 2 most substantial ones, as you can see. Some of them are done on a per month, per head basis. Some of them are done on a percent of premium basis. This particular one here, this 4th one down, is the money that the federal government. So remember, we had to all set up these exchanges, but it costs money to create the technology, and then we have to hire staff to staff them, and all these kinds of things. So the federal government needed some money to do that with, and so there's a 3.5% fee. And the ironic part is you would think maybe that would be only on insurance that is bought at the exchange or the marketplace, but actually we get to spread that amongst everybody, gets to share in that part of the wealth. So all things totaled then, and the question was asked, one of the ones I delayed is, how much is our premium going up next year, okay? So this is kind of a graph of what we are expecting, and we had this graph before we ever saw a premium on an exchange, which we finally just saw the other day. But when you throw all these things in a box, okay? So we got the taxes and fees. That's being estimated to be 4 to 6%. That's what we just talked about. We have the risk pool aggregation, so we're getting some occupations maybe that are more high risk that could lead to more claims. You got the guaranteed issue and the community rating, so you got the people coming in with the burning building. You got the essential health benefits, so we have to add coverages that we didn't used to have. That costs money. Trend, actually, that bottom one, that's the only thing, that's what you're used to, okay? So of those 6 bubbles up there, we have 5 new bubbles raising premiums, and then you got the 6th bubble, that's what's always raised your premiums, okay? That's that we have an aging population, and we have more and more technology and more drugs that can help save people and have longer, happier lives, but that also costs money, okay? So you throw all those into the mixing bowl, and we were predicting rate increases in the insured market of 10 to 40%. Now, that would be for, comparable coverage. So comparable coverage to what you used to have could cost 10 to 40% more. Now, what you're hearing sometimes, and you're hearing less of it now, but what the government did is they found some of the states where they had some pretty good, in their opinion, premium news, and they started saying, rates are going up less than what was predicted. They're not going up by as much as people thought they would. Well, what you find when you drill down into that is what we talked about earlier. The rate didn't go up that much because instead they increased your deductible from $500 to $3,000 or something like that, okay? And potentially also, if you're ever buying on these exchanges or marketplaces, and if you work with us, we'll help you look into this, narrower networks. So that goes to another question I had about who can we see, what doctors, okay? So their premiums are still going up, not as much as expected in some cases because they've turned around and reduced coverage, basically, okay? But to answer the question then, in terms of the MDA plan, we're going to renew it early. This is, again, you folks who are paying your bill quarterly. The rate increase is on the very low end of that. It's going to be just under 10% this year. We feel that's pretty good in this world and market. I know it's not exciting news to anybody to have your premiums go up, but we were able to hold the line on the low end of this rate increase. And then we're going to talk here in a little bit about what we're doing in the future, maybe to try to avoid the high end of the rate increase as time goes by. So with that said, I think it's time to bring Tina up again for a little while.
Craig did tell you guys all it's just under 10% for the new rate increase for all of you. You probably just got letters. I know they were delivered because we got just over 100 calls yesterday on that letter. So I'm going to take 120 calls right now and explain that letter to you that if you received it. All right, what that letter says is if you want to make a policy change for next year, you must do it this year. So yes, if you like your plan, you can keep it with the caveat of only one more year, and Craig's going to tell you what we're going to look forward to in the end of 2014, 2015. But what that letter is telling you is, unfortunately, yes, we had to take a rate increase, 9 to 10%. It varies depending on the plan you're in. Let's say you're in a Community Blue 250. It got a 9.5% rate increase, I believe. You want to lower that rate increase, you could move to the Community Blue 12. So to lower your premiums, unfortunately, you get a little more risk by a higher deductible. If you want to do that, you have to do it December 1st. So I have to make that plan change this year. That's what the letter's telling you. If you like what you have, you're wanting to accept the premiums, you don't want to rock the boat, you can throw that letter away. What I can't have is when you get your bill and you go to pay it, because let's face it, nobody wants to pay that bill by January 1st. You go to pay that bill January 2nd and you're like, holy cow, that's a huge rate increase. I can't fix it. So I have to fix it this year. That's what the letter's getting to you. You'll get your new rates and premiums in December, so we'll still have time to fix it in December. But in January, the only thing I can do to your policy is add a baby, add a spouse. That's it. I can't change anything else about your policy. I can fix your address, that's about it too. But I can't move you from a higher deductible to a lower deductible. I can't move your, like right now I know there's a couple, if you work in the office, so you're the dentist and your wife works in the office, if your wife is, if you're 65 turning next year, you also got a letter and I suggested, hey, let's make that young lady the policy holder. So if you go Medicare in 2014, she doesn't lose her coverage. Ta-da! All right, so we're trying to work those out. If you have questions, give me a call, but I'm hoping I answered that letter for all 120. The ladies will appreciate 100 less phone calls tomorrow or Monday. But again, if you have additional questions, see us afterwards, or feel free to call our 877 number. Everybody got a business card with that number on there as well. Any questions on that before I click slides? I know a ton of people had questions on that letter. Yes. If you have a new employee, I need the app in no later than November 15th because I got to get them a December 1st or December 15th effective date. If you get a new employee in February of next year, we're still going to be able to help them, but we can't put them in the same plan that maybe all of your other employees have currently. Until Craig explains the new option we're looking forward to, we'll make some changes in the future, but nobody else new will be able to go into that Blue Forever Life plan. So we'll still have an option for the employees, but we won't be able to put them in the same plan that you're in currently if you have a new employee. In the letter, the rates are going up 9.5%. So you got the rate sheet, and then you'll see the rate increase. What you will see in January, and I believe on that rate sheet it actually says we still have the Michigan claims tax, which Blue Cross for us individual market is multiplying that by the 0.0081. That's the tax you're seeing now. It was supposed to go away. Ta-da, it didn't. The new taxes will be a separate line item on the bill and included. The one thing that all of you with the pink card don't have to pay the marketplace tax. So we don't have that 3.5% in the individual market. So that's one tax we will avoid. All the other taxes, unfortunately, will be on that bill. I am working with Blue Cross to find out how that's actually going to come on the bill. If it's just going to be one lump sum tax, or for my small group plan holders, are you actually going to be able to see the tax per person? Because if you're a small group and let's say your monthly premium is $6,000, you don't want a tax line item that says $1,200 and not know how to break it down per employee. They don't seem to get that, but I get that. So they're hoping that that'll come itemized. For the individual clients, it's an individual tax, it's an individual bill. It's your tax, so it applies to your account, so that part will be a little bit easier. You're just not going to see that this is the dollar tax, this is the 0.75 tax, this is the 3.5 tax. It's not going to be broken down that. It's just going to say healthcare reform taxes. It's about as clear as they can make it. Clear as mud.
Are they taxing your healthcare costs or your...
They are taxing the premiums.
Okay.
Yeah, it's taxing the premiums. The only time you're going to get taxed on your actual income is if you don't take insurance, then that's where the 1% comes from. Yes? It will be included in the January bill. So in December, when we bill you for January, you will see your rate increase and the new taxes. So that's why it's important that if you want to make a plan change, you're thinking about that extra 10%. Again, those taxes are in addition of that premium increase. If you are on auto pay, I'm assuming, okay, so if the question is how will it be deducted? So we bill everybody quarterly on the individual market. Some people pay that monthly through an auto pay. It'll still be divided monthly for you for the taxes. So if your bill's $3,000, we're going to deduct $1,000 every month. Okay. Okay, so I explained no benefits, policyholders, spouses and children, and then again the no employees. So we can still help the employees, I just can't get them in the blue Forever Life plan. All right. So again, we are all licensed to help with the subsidy. So if you do get your new employee, we can work with them on or off the marketplace. We do still work with Blue Cross for the individual market. Those are the yellow cards that nobody had, but you possibly have a child maybe that has the MyBlue. If you've had a 26-year-old child that's come off, they went into what they call a young adult blue. They're the ones that are getting these letters right now. The letters say they're from me. I've never seen these letters. It even has my direct line. They can call me. I will walk them through it. But it tells them in the letter, your policy's ending at the end of this year. We're recommending, and it'll say something. Value blue, keep fit 7,500. So it'll give them an option to look at. We will run all the options. They don't have to take what's recommended. If they do nothing, Blue Cross will map them to that plan. If you pay the premium, then you're saying, yes, I'm okay with this change. Alrighty. Okay, so the groups. If you have an orange card, you had the option a little bit earlier this year. Let's say you renewed in January or February. You were given the option to postpone that renewal. Just like we did with Blue Cross, we said, hey, we want to renew in 2013 to avoid some of these official mandates. The small groups could also change their renewals, and so they went to December. So if you did that, your orange card would say renewal December change. What that means is whatever's on your orange card for that month, that is when you are going to get mapped to a healthcare compliant plan. So that's when all of your healthcare reforms and your mandates and essential benefits will kick in. You will still pay the new taxes 1/1 of 14, even though they're not healthcare compliant plans. And then when we deliver those renewals, we will actually bring out 3 different alternatives with that mapped plan. So the goal with mapping was to keep you within your family. So if you're in a Community Blue PPO, they wanted to keep you in a Community Blue PPO. Saying that, they're all platinum plans. You don't have to be mapped to a platinum plan. You can choose a silver or a gold or a bronze plan. That's what you'll meet with your agent to discuss. All right, And then build those small groups. Again, the orange, when Craig talked about member level rating, this is something the individual market we get to avoid for a little bit. Those over 65 kind of already experienced this. As you'll notice on your Medicare bills, every year you get 1 year older, your bill goes up just slightly, a little bit, so it bases you on your age. In the small group market, it used to do a member average age of your office. That was the benefit of going to a small group. In the new world, when you get mapped 1/1 of 14, you are actually going to be member level rated. And what that means is each person has their own rate, and it's by age. So it's no longer every 2 person in your office or every single person in your office is going to be one age. The 0 to 20 is one age, 21 to 64 each have their own individual ages, and then 65 plus has its own age. So, for example, you have a hygienist who's 34, she'll have a rate. You have an assistant who's 42, her rate will not be the same as it is right now in the current market. It will be based on each age. So we do expect a little bit of problems reading these, but we will work through them. There are some rules, and I believe Craig will talk about them here in a little bit, about discrimination, because we can only see this leading to more problems. All right. So that's my small group. I'm so glad I got that great news. Any questions? The question is, can you, if you're in a small office and your employer doesn't offer health insurance, you can get into the MDA BCS Forever Life Plan as long as you work 20 hours. We just need to, and we've got applications here, just stop over, we can give you an application and you can get in, and that will hold your plan design in place.
Even if your dentist isn't doing
Even if your dentist doesn't. Yep, you just have to work for a member.